Hi, I'm Dr. Lisbeth Roy. Thanks so much for joining me. I wanted to talk briefly about female sexual dysfunction. It's a bigger problem than most of us realize. There are many, many women. In fact, it's estimated to be between 30 and 50% of women who suffer from some degree of sexual dysfunction. Sometimes that can be a decrease in desire, which we often call libido. And we think of postmenopausal women having this problem, but I'll tell you, as a hormone specialist, I see many, many men and women, and women of all ages are complaining about low libido, especially after childbirth. It's not uncommon to have hormonal changes and also a decrease in sensitivity, which leads to this decrease in libido. There can also be pain associated with sex, which will certainly dampen any woman's desire for sure. There are other vaginal issues that are related often to hormone imbalances or dysfunction in the vaginal tissue, and that's incontinence. Many women after childbirth again or postmenopausally will have some incontinence issues. There are orgasm disorders where a woman just is not sensitive enough to be able to be aroused to a full orgasm. There are also arousal disorders, for that matter, women who just are not able to become aroused, and therefore the tissues are not prepared for intercourse. There's also pain with intercourse that can be due to various reasons. The most common that I see in my practice is vaginal tissues that are dry and hormonally out of balance, which is relatively easy to fix from a global perspective, but not necessarily easy to fix with hormones in the full repair of sensitivity, for instance. There's a procedure that I do here called the O shot. It's been featured on shows like The Doctors. I believe Dr. Oz has talked about it, and it's gaining some popularity. It is an excellent procedure done with women, whether you have a true diagnostic sexual dysfunction or just simply a decrease in sensitivity that you didn't have before. So this procedure treats many degrees of sexual dysfunction. It is simply the injection of platelet-rich plasma intravaginally and also in the area of the clitoris. Platelet-rich plasma made from your own blood. There is many, many growth factors and healing factors that are in the plasma that occur naturally. When we injure ourselves, these healing factors are activated and they arrive on the scene and they repair tissues. And they do that by stimulating stem cells. So for instance, if there is erectile tissue in the clitoral area or the penis of a man, there are stem cells that exist there. The platelet-rich plasma will stimulate new cells to be produced from the stem cells. And there's nervous tissue in that area. The PRP will stimulate new nervous tissue and new blood flow and all of the things that are necessary for rejuvenation. We use this platelet-rich plasma in many areas in medicine. It's been used in dentistry for decades, actually very successfully. It's been used in orthopedics. You may have heard of Kobe Bryant, I believe, was returned to the game because an orthopedic surgeon was able to place the platelet-rich plasma in the joint space. Again, it stimulates stem cells, so whatever tissue is in the vicinity will be repaired and even enhanced in this particular case of the O shot, and for men the Priapus shot. There has never been any harm done by injection of platelet-rich plasma. We have lots of experience with this platelet-rich plasma in dentistry, as I said, for decades, and actually now almost 5 years experience with platelet-rich plasma in aesthetics. Yale University wrote a paper just recently touting the benefits of platelet-rich plasma when used in conjunction with other wound care. So you can see it's just a natural regenerator. And the O shot is a fabulous procedure. I love doing it because it's very effective, incredibly safe. and quite comfortable. Very easy office procedure. So typically what I like to do is evaluate my patient. We'll talk about hormonal balance. We'll talk about maybe reasons for the dysfunction. Is it a desire issue, in which case we need to restore hormonal balance? Is it a pain issue? Is it a lack of sensitivity? Was there trauma to the area? Sexual counseling is sometimes and often actually appropriate because there are a lot of psychological effects of low libido or lack of orgasm or sexual dysfunction. It's disruptive in a family quite often and in the intimacy of a partnership. So it's very important that women and men have these issues addressed. And with procedures like the O shot and the Priapus shot for men, it's just a wonderful addition to our lacking treatment options, really, when it comes to female sexual dysfunction. So make an appointment. We'll chat about what your issues are and help to get you on the road to recovery and proper sexual function. Thanks. We'll see you soon.